So in our clinic, we have our blood chemistry machines and our CBC machines. Each machine has its own monthly or weekly maintenance that needs to be done on it. I'm going to do the quality control on my blood chemistry here. This is the Catalyst 1 through IDEX. So it's a monthly need to do. It helps clean the analyzer. So I go through the steps. It tells me what all I need to do to prepare the analyzer to do my monthly maintenance. At this point, I've done it so many times, I don't really need the instructions anymore. So I need an alcohol prep pad. I take this out. This is what runs each little clip, you know, in the system. I'm cleaning the inside where the clips run through, because it'll build up with serum, material, whole blood, you know, so you just got to clean it time to time. Make sure everything runs smooth and properly. I'm just going to dry it. It's just a lens wipe. Make sure all this is looking okay. Nothing's built up on any of it. So then I put that back in place. And lock it back into place. Okay, and then when I'm ready to do the quality control. So whenever doing the quality control, the solution that's used to do it, it's a timely process. You have to let it thaw from the freezer. You have to mix it with your stuff and let it sit for another 45 minutes till about room temperature, and then it's ready to run in the machine. Okay. Anyways. And then you have a quality control clip. So whenever everything is done running through the machine, it'll give me results of how my analyzer is running and if there's anything that needs to be done or if things are running okay on it. So I'm going to take my already mixed Vetrol solution, because it's the control solution. Let me get it open. I'm taking my pipette to get the amount needed. These are sent to us through IDEX. So I'm adding it to the sample cup in the machine. Then I'm taking my quality control clip provided through IDEX. This is what they use for us to run this particular maintenance on this machine. Loading my clip. Shutting my door. Gotta go through till it's ready to run its cycle. And that's how we run the quality control. It's going to start running its cleaning process, and there's nothing for me to do but wait for my results. To perform a heartworm test, this is the test that we're using. It's by a vet scan. It's canine. It's an antigen test. It runs off of whole blood or serum. So to do the test, it's very simple. It tells you on there how much sample and how much of the buffer that you need. So I've already drawn blood for the heartworm test, so I'm just going to use it. It needs 1 drop of the sample, so of the blood. So I'm going to put 1 drop on there. And then two drops of the buffer. And then it has to sit there and run 5 to 10 minutes before I can read the results on it. And I'm going to write Harley's name on it. So that way if I'm running multiple tests at one time, I'll know which dog is which test. So now that the heartworm test has run its time, it's 5 to 10 minutes, we're going to read the test. This is Harley. The control, the line just shows that the test is working properly, And the T, if there was a line there, that means that she would be positive. So she was a negative heartworm test dog. There are a couple of different ways to obtain a stool sample to do a fecal testing for parasites. One way is for the owner to bring in a fresh sample that the animal had just done, usually within 30 minutes to an hour before their appointment. It's a good idea to bring it in. If they can't obtain a sample, that's fine. We can go the method of getting it manually with, this is our fecal loop. It goes straight into the rectum of the animal. It's not as comfortable for them as if they were bringing their own stool sample. But for me, I already have my stool sample, and I'm going to set up for a fecal flotation. This is our solution that we use. It is the sodium nitrate. It has a specific gravity of 1.25 to 130. This is the fecal solution for our flotations that we use. I need a cup, I need my microscope slide, and then I'll need a glass cover slip for looking at it whenever I'm done. So I'm going to take my sample, get it open. I'm going to take my fecal loop, and I'm just going to obtain some of the sample out of the cup. I'm going to put it in here, and this is the fecal solution. We just have it in a smaller thing. It's easier to use. I'm going to make sure I get it all in there. I'm going to fill it all the way to the top. I'm going to take my cover slide, let it sit there. It's got to sit there maybe about 10 minutes before it's ready to read. This one was already set up, so whenever this one is done floating to the top, letting all my eggs and stuff that might be there float to the top, then I'll take my cover slide, I'll take my one ready to read, just carefully turn it over, put my cover slide on, and then it's ready to look at. To do a direct smear, I need my slide, my cover slip, and this is fecal solution that I'm just going to use. I need a wooden applicator and my stool sample. So I'm going to take my fecal solution or saline. You can use either or. I'm just going to put a few drops of it onto my slide. All I need is a tiny amount of stool that I'm going to get on my wooden stick here, and I'm going to mix it in with the solution, and I want it to be mixed until it's just completely combined together, and then I'm going to be able to see through it. So once there's no more chunks of stool, I can spread it out. It's really thin, you can see through it. Then I take my cover slide and I'll put it over, and then it's ready to look at under the microscope. To do a fecal flotation by centrifuge, I've got about 30 grams of my fecal solution. I've got 30 mils, excuse me. I'm going to try to use about 2 grams of my stool sample that I already have here to mix in with my solution. Try to mix it pretty well in there. Okay, these are the tubes that I'm going to use for the centrifuge part. I'm going to take my gauze pad here to strain off any of the excess stool. I just kind of want the fluids. I'm going to fill it about halfway full. The other tube I'm simply going to fill with some water to counterweight when it's doing the centrifuge. Gets a little messy, so I'm going to use another one. Keep straining. Okay. I'm going to go over to the centrifuge. going to go ahead and fill this one up. Well, we'll put this one in first. We'll fill that one up with some water, same amount. So it goes on to the other side to counterbalance it. And then you close it, and it's going to run about, I don't know, 40,000 RPMs, about 5 minutes long. But for video purposes, I'm not going to run it. I'm just going to go in and show the next steps. So after it's done centrifuging for the 5 minutes, I'll come back. I'll get what was centrifuged. And then this is when it's ready to look under the microscope. I've got my microscope slide. I'm going to use my little hook here to just take fluid off the top. All my sediment should be at the bottom. I want the stuff that's at the top. Just barely get any. I've got my drop. I've got my cover slip to go onto it. And then it's ready to look under the microscope. This is a fecal test by sedimentation. I've got about 30 mils of just water. We don't need fecal solution for this one. I've got my stool sample. I need a little more than 2 grams this go around, so I'm going to get a pretty good bit of it to mix in my water. Get it kind of mixed up really well, broke up. And there's 2 ways you can go about this. I can either put it in a centrifuge tube and centrifuge it for 5 minutes, but I'm going to let it sit here. It can sit for 20 to 30 minutes before it's ready to be examined under a microscope. Now that it has sat here and floated out for about 20 to 30 minutes, I'm going to take it over to the sink and I'm going to carefully pour out as much of the liquid as I can so I can get to my sediment that has settled in the bottom without disturbing it too much. I don't want to pour that part out because that's what I need. Okay. Now from this point, I'm just going to take my little pipette here. I'm going to take a sample from 3 different spots and from the sediment, and I'm going to make, all I need is a drop from each. We'll go on the outside. Put it on there. Just 1 drop. Kind of from the middle. That way I'm just kind of looking at the whole spectrum. Maybe some of my eggs have settled into one area and not the other would be the reason that I'm doing this. Here's my 3 drops. And then I'll take my cover sheet, my cover slip, and I'm going to put it on there. And then it's ready to be examined under the microscope. To do cytology on ears, I'm going to swab Harley's ears here. I've got my cotton tip applicator. She's got one really bad ear over here that we're looking at. So I just stick it in. I don't go too far. I don't want to get anywhere near the eardrum, and I just try to get some of my sample. Then I take my sample to do cytology on it. I'm just going to take it and rub it lightly across my microscope slide, just so there's a thin layer there that I'll be able to stain and see. Now we use the Dip Quick Stain, the 3-step staining system, and how I've learned to do it, ideally you would let this air dry for a little bit before you move on to staining, but for video purposes I'm going to move on to show. I just know which steps I use, and per the staining instructions, it's got to be dipped into each stain, the fixer, what's that one? Yeah, the stain. Sorry. 14 times each. This is just a quick way to stain. It shows accurate results for whatever I'm looking for under the microscope. Whether I'm looking for yeast or bacteria in the ear is kind of what we're staining and looking for with this one. Okay. Now I'm going to take it and rinse it. Rinse all the excess stain off of it. Very easily, gently. I don't want to wash everything away. I just want to get the stain off. And again, ideally we would let this air dry, but for video purposes, to move on, I'm just going to lightly dry it slightly with the paper towel, just so I can show how to do it with the microscope. But like I said, usually we let it air dry before we move on to the microscope. Okay, so now that it's stained, I can move on to the microscope. I like to start at a lower magnification just to kind of get my field of the field that I'm looking at. I'll zoom it in and then I'll move on. This is a 40 times. Yet again, kind of get to a better area. I can already start seeing some staining. And then my final one is my oil. It's 1,000 times magnification. You got to use oil to be able to look through this one. Get my oil in there. Focus yet again. Now that I've got it in focus, I can move the microscope, slide back and forth to be able to look for things, and already I see lots of yeast. Not any bacteria. Just lots of yeast. So this dog primarily has a yeast infection, so now I know what to treat for, which medicine to use to help her get through it. To do fungal testing, so if we have an animal that's starting to get some dry, scaly skin, we can test the skin for fungus growing on it. You want to do this by taking a set of hemostats, finding a scaly area on the animal, and you're just wanting to pluck a few hairs and some scaly skin from that area. Doesn't take much. I'm going to take my specimen here and I'm going to put it into my media. I'm going to get it to where it's down in it. That way it can incubate in here. This stays in the fridge. I had to warm it up to room temperature in order for it to work. I'm just going to lightly replace the lid. And then we're going to store it in a drawer, just at room temperature and away from any light. Then we'll be able to look at this starting out in about 3 days from now. We'll take a look at it to see if there's any color change in our media here. If it's starting to turn a little red, then we know that maybe there's something there, but we're not going to discard of it yet. We'll still let it sit and incubate for about 21 days, and then we'll look at it under a microscope to either verify that there really is an active fungus on the skin or if it's something else. Okay, we're 6 days into our culture being incubated, and looking at it, it is turning red. Like I said, maybe it will, maybe it won't. So it tells me maybe there's fungus there, maybe there's not. So we're going to take just a sample of it and look at it under a microscope to either confirm that it is or that it's not. So I've got my piece of tape here. All I need is a small sample. Just touching it right on where it was. I need just a tiny drop of stain. I'm going to cut off my piece of tape that I got my sample from. I'm going to put it directly onto the stain. And then I'm going to look at it under the microscope. To be able to see any spores, if they're there, under a 10 magnifying. Now, we don't do this all the time here in our clinic, so I keep my book nearby that kind of gives me an idea of what the spores look like and if there are any or not. So just examining it. I see a lot of hair from the follicles. I see my stain. As of right now, I'm not seeing any actual spores. So this tells me that possibly this was not fungus. It was just something else that can cause the media to turn colors like that. To do a skin scraping, we're going to do it on Ivy here. The owner is saying that she's licking a lot at it. She's got some inflammation over here. So I have mineral oil, my slide, my cover sheet, my tin blade that I'm going to use for my skin scraping. I'm going to go ahead and carefully open the blade. This already has mineral oil in it, so I'm just going to put me a drop on my slide. I'm going to take my blade and I'm going to just dip it into the oil. Now, to do the scraping, I'm trying to find a good spot that she has on her. She doesn't have a whole lot of hair, or we would typically cut her, and she's a little bit of a scary dog. Maybe you're okay. Just sliding. You're okay. You're okay. So I'm in the wrong spot. Okay. I'm picking an area that's kind of scaly, and I'm just going to scrape. I don't want to cut. And I'm going to scrape until I get a little bit of blood. Now I'm trying to get some of her healthier looking skin plus the inflammation part. So after I've got my sample, I'm going to put it into the mineral oil. Find my cover sheet here. Put my cover sheet on it. And then it's ready to look at under the microscope. I'm going to start with my 4X lens. It's the scanning lens. It just kind of gives me the big picture of what I'm looking for. I'm kind of looking for mites by doing this. So I can see the hair follicles that I've got out of the scraping and some blood. I'm looking for anything that might be moving, any mites that might be there that's causing her inflammation, which I'm not seeing any. If I were to have seen something, I would have gone to a higher power lens to try to identify which mite it was. And being that I'm not seeing mites, my next step would be to take this sample to Pathology to look for yeast and bacteria on her skin. Okay, performing a necropsy. First step is protective wear. We've got our gloves, our mask, our gowns. It's to help protect us from whatever the kitty may have had. Don't know much about her, so if she had any kind of disease that we might catch, this will help protect us against it. We've got our blade and some forceps and some needle nose and some scissors. We've got our sample jars and our formalin. And then I'm going to hand it over and we'll start doing the necropsy.
So the first thing that we would do is just do an external exam on this kitty. We're going to be pretty brief just for the aspect of the video, but we would kind of go over externally, see what kind of condition the animal was in, see if we see any external wounds, any abnormalities. This kitty obviously has a prolapsed colon, so we know why this kitty, why we euthanized this kitty. So we would continue on after we did our external exam and noted all that down on our necropsy form. And we would start off by doing a midline incision. Now this kitty has been frozen for a little while, so we'll make a midline incision. Now of course if we were doing one where we wanted to actually kind of really find out why this kitty was deceased, or if we were trying to find a reason, then we would look at everything on this kitty. We would kind of skin this kitty back and look and see what kind of fat we had, look and see if we had any bruising, anything, like I say, that just obviously would jump out and start us to get an idea of what went wrong with this kitty. So we're going to make our midline incision. And once I get a opening, I'm going to go ahead and open up the abdomen. When I get the abdomen open, I'll go ahead and cut up to the sternum. This kitty was a feral cat. So then we would open everything up and peel back our skin so we could exteriorize everything. Usually we'll kind of make a flap here. Peel this all back, look at the musculature. Everything looks pretty what you would expect on this one. So we would do the same thing, and then I'll just go ahead and use my scissors here and open her up. Make it a little bit easier to get to. So then we would get to internal organs, and we would just basically on a necropsy go through every organ system. So we would and kind of, I guess everybody has their own way of doing it. We have a form that we follow. So we would get in here and start out with stomach. We would go through and run all the intestines, small intestines, down to the colon. If we saw any lesions, we would want to take samples of everything, kidneys, caudal aorta and vena cava. We would just go through everything. So we're just going to jump ahead and go ahead and pretend that we're wanting lesions, that we see lesions, or that we're going to take samples from. So here's a kidney. We're going to take just a wedge biopsy or a piece of this kidney. Being small animals, we could do like a whole organ if we wanted to. So we would just take a section of a kidney, and Jennifer can tell you what we're going to do with it.
Then we're going to put it in our sample container. We're going to put some formalin on it, and then we're going to label it with the name of the owner and the kitty, our information at the clinic, and then what organ this is. And then we'll submit a form with both samples of everything that we're sending in, the history on the kitty, the everything that we know about it, to be able to obtain some results of what may have happened to her if we did not know. Formalin.
And again, on this kitty, I'm not seeing a whole lot of just obvious lesions in here, anything that I would, particularly get, but we would get kind of a rough sampling of all the organs if we were doing a full necropsy on her.
And then oh, go ahead.
Good.
I was gonna say, well, when we're done, then we would.
Yeah, I mean, like I say, a full necropsy, we would go ahead, open up the chest cavity. We would look at every organ on this kitty. We already know what happened with this cat, so we're not going to go much further with her. We're just trying to give you an example of what a necropsy would be and the proper way to do it.
Okay, rabies suspect handling. If we have an animal that is deceased, we suspect maybe it died from rabies, then what are our protocols? We are going to send, well, who can do it first? Let's go there. Who can perform the rabies procedure? It's going to be either the veterinarian or a technician who has been pre-immunized against rabies and has a titer of 1 to 5. They're the ones that can handle the suspect. So then we're going to mask up. We need to be double gloved. We need a mask. Maybe eye goggles. Your gown is for the smaller animals, and if we're dealing with larger animals, anything over a large dog, equine, something like that, you also need to have an apron over your gown, double gloved again, a face shield, and maybe some rubber boots. So just a little extra protection for a larger one. Depending on the state that you're in, depends on what specimen needs to go. So it's either going to be the full skull, head intact, going that way, or some states require just for you to remove the brain and send that. The state of Texas, we can send the whole skull. So we're just going to decapitate the patient. It's going to be double bagged. It's going to go into a cooler and packed on ice, not dry ice, and then we've got labels and certain forms that it's going to go with it to the appropriate laboratory to diagnose it. And what's my final question? Sorry. Oh, the remainder of the body. It is also to be double bagged, but it needs to go into a red biohazard bag, and it's to be disposed of as biohazard material. So this is everything that we're going to need to do our vaginal cytology. We're going to use a speculum that's going to be lubed up so it can go through the vulva into the vagina. I've got our cotton swab, which I'm just going to use some sterile saline to moisten it. I've got my microscope slide to put my specimen on. I've got my drawing a blank.
Laryngoscope.
Yeah, the laryngoscope for the light to see. So I'm going to start with first scrubbing.
Wait a minute. Come on. I don't see.
I'm going to scrub just to get the outside area sanitized and clean. And rinse it with water. And then I'm going to pass over for Dr. Zamzo. Now Dr. Zamzo is going to insert the speculum that's already lubed up into the vagina. Just using that to make sure she is in the spot that she needs to be in to get her sample. Now she's taking the sterile swab that's already been moistened. It's going into the vagina, up vertically over the urethral orifice to get into the vagina. Right. And it's going to be a circular motion to line the vagina to get the cells onto the swab. Then from that point, after she's gotten her sample, I'm going to take it and take my microscope slide, and I'm just going to roll it. Gently roll it on there. And then I'm going to stain the slide. Sorry, I'm going to be walking all over the place. After I've stained the slide and got it prepared to look at under the microscope, I'm going to be looking for whichever type of cell that I see will tell me kind of what stage of estrus that she is in. Walk and rinse it off. Rinse off just the excess stain. Just light water. I don't want to damage any of my cells or wash any of them off. And we would normally air dry, but I'm just going to take a paper towel just to lightly dry it off a little bit, so I'm not damaging any cells doing this either. So once it's dry, I'm going to examine it under the microscope. Starting with my lowest power just to kind of get my feel of where I'm at. Just work my way up through so I can get it focused in. And then my final one is my oil layer, the highest power. That way I can look at the cells, you know, as close as possible and be able to identify maybe what I'm looking at a little better. So right now I don't see any red blood cells or anything to tell me that she is in get the name of the cell that I do see. Parabase.
The epithelium.
Yeah, the epithelium, that's what it is. The epithelium cell is what I'm seeing. So this is just telling me that she is in anestrus cycle. So the different stages are the anestrus is when she's not in heat. She's there's no behavior towards the male. Her reproductive system is at rest. There's very little secretions, and the cervix is closed. And the only cells that we may see will be intermediate and parabasal cells, which is what I've seen on the microscope there. The next stage would be, or the next cycle would be proestrus. During that stage, she's starting to become into heat. We're going to start seeing an increase of estrogen, follicle develops, enlarged uterus, the vaginal epithelium thickens, the vaginal walls. We'll start to see red blood cells in large numbers. We'll start to see neutrophils and a lot of bacteria in this stage. This stage lasts about 9 days. So the males are attracted, they can smell them at this point, but the females are not ready to stand and breed yet. So the next stage is estrus. It also lasts an average of 9 days. This is when the estrogen is developing and estrogen decreases and the progesterone increases. It'll be large blood flow. Ovulation is during this time, so she is in full heat during this time, and she is ready to accept a male. And the cells that we'll see on that slide, if she was in that stage, are all superficial, cornified. All the cells are cornified. Most any other cells are not seen at this point. The bacteria and the neutrophils are almost not present. And then the final stage is diestrus. We're coming out of estrus. We're kind of returning back to the anestrus stage, which is what Sissy is in. And within almost one full day, her cells can go from being superficial, cornified cells to almost completely normal cells. So that's kind of the stages of the estrus cycle. Okay, we're doing cross-matching. The purpose of cross-matching is to see if a recipient can take a donor's blood if so needed. So we already drew our blood. This is Brewster's. He is my donor. And Gun is the other dog. His name is, he's the recipient. So we already centrifuged them down. And the purpose of this is that we want to keep the serum off of it. So I'm going to do Brewster's real quick. So I'm taking the serum off of Brewster's red top tube, my donor, excuse me. And I've got all my tubes labeled and who is who, so we don't get nothing mixed up, and what is what. So I have his labeled Brewster, and it's his serum. Okay, after I pull his off, I can dispose of this. This is not needed anymore. Replace his lid. And we're going to do the same for Gun. Gun. Blood. His serum. There. Okay. I discarded that one too. And then the next tubes are, I want to get rid of the plasma and keep the red blood cells, so I'll just do Brewster's right now. This was an EDTA tube. We've already spun it, so it's already separated the whole blood. And I'm just getting rid of any plasma or serum that he has in there. I won't do Guns just yet. I'll do that, but I'll just show you how to move on. Then I'm going to fill the purple top tube. This is 9.9% sodium chloride. This is called washing the red blood cells. I want to fill the tube, leaving enough room to put my top back on. And then I'm going to do the same thing to Guns, my recipient. And then we're going to take this and centrifuge it down again. And we're going to get rid of our decant. We're going to do this 2 more times, washing the red blood cells. So I'm going to go on and move on to that next few steps and get those done, and then we'll come back at the end. After doing the final wash, then you make a erythrocyte suspension. I've already done my donors. I'm going to do my recipients now. I've got to get rid of the decant. So all I'm left with is my red blood cells. And as you've seen, the decant was nice and clear, which means it was washed properly. So, in my red top tube, I need 0.98% saline. I've already got it pulled up. And then I need 0.02 red blood cells. And I mix it with the saline. And this is how you make your suspension. Okay, next step, we're going to do our major and our minor cross matching. So for the major cross match, I am taking 2 drops of the recipient's serum. Gun as the recipient. I'm going to take serum. Back over here. I need 2 drops of his serum. 1, 2. I'll leave that there. I'm going to need that in a minute. And then 2 drops of the donor's cell suspension, which his is already mixed. 1, 2. Okay. And for the minor cross match, I need 2 drops of donor serum. Burster. And 2 drops of the recipient's suspension. So the final step, I'll just do one to show it, is to make the control something to look back for before we let everything sit for 30 minutes. So I need just serum. From the donor, the donor itself, mixed with its own suspension, or 2 drops of its own. And I'll do the same for the donor, and then that will be our controls. Okay, now that it has incubated for 30 minutes and we centrifuge them for a minute, we're going to visually look at our tubes, my major and my minor cross matching, and I can already see, compared to one of the controls, that there are major hemolysis going on in these tubes, which would tell me that these 2 animals, my donor and my recipient, would not make a good match. If I did not see this, then I would take a sample from each one and look under the microscope. I would be looking for agglutination under the microscope. Pretty much tells me if my red blood cells are all clustered together, then they're not a good match, and then if they're nicely spread out, nothing's clinging together, then they would be a good match for blood donation to each other.